Hello everyone, and today I'm very excited to be with Dr. Yudhanshu, who has secured an amazing rank of 195 in the recent INICET examination. So, welcome, Dr. Yudhanshu.
Thank
Heartiest
you, ma'am.
congratulations.
Thank you, ma'am. Thank you very much. Good evening, ma'am.
Good evening. As Yudhanshu was our advanced pack user, and we were talking that he utilized most of the videos, right, Yudhanshu? So, how
Yes,
did
ma'am.
you started, and how these videos helped you?
So actually, our exam was only objective type in our prof only. So I started there only. So first started with in third year. I started with ophthalmology ENT. I finished up these subjects early on, and then moved to the fourth year subjects like Tamim sir videos and J. Arora sir videos, and
Mhm.
finished this off, and then to the Obs Gynae and pediatrics. Pediatrics is kept for last, and I had my own notes, handwritten notes, and that's it. Just revising that notes for professional examinations because we had objective type of examination in a prof, so that helped me a lot. Your videos and the content helped me a lot, and just revising that is more than enough. I think it's actually more than enough in that videos.
Right. So, which videos, like you said that you watched most of the videos, which videos helped you most?
Uh, I would like to take an example of Jay Arora sir, that breast video. It not only covers the breast, it also covers the most of the general aspects of the general surgery. So that helped us a lot and gave me most of the that confidence it gave, because he explained the content in a very crisp manner and in very good manner, that I must thank thank him if he was listening.
So, Yadhanshu, as you said that it was sufficient. Now, this is a very important statement because if you will agree with me, कि आजकल students have the fear of the missing out. Like FOMO is
Yes,
very
ma'am.
common. So, what will you say about it? कि if you are sticking to the videos, is it sufficient, good enough?
Actually, it's more than sufficient, I would say. It's not only sufficient, more than sufficient. I have to cut it down actually in
Huh.
order to make my notes just more crisp. So I'll advise, make your own notes if you are in third or fourth year, or even if you are in internship. If your internship is not hectic, as our in our institute internship is not so hectic, so we made our own notes. So just at the end you have to cut it down, just boil it down to some of the pages. Like I had 10 to 15 pages of ophthalmology, 30 to 35 pages of surgery, and etc. It is a very much not generalized. It is subjective to one person, which content you are forgetting, and like that only. So it's more than sufficient. It's not sufficient. It's more than sufficient. Just stick to one source, and you can do the MCQ from other platform. That's your own choice. But just for a one subject, I would advise to stick to one source and trust your teacher, trust your instinct. That's more than sufficient. Nothing extra is required. You just have to just wait for the miracle. It will happen.
Okay, so Yudhanshu, what do you say about the PYQs? Like, PYQs are very important for any entrance examination. So after attending these videos, were you able to solve the PYQs? Were your concepts clear
Uh,
about them?
yes, I would like to tell you that many of the faculty, almost all the faculty made their content around the PYQ. So after your watch, if you are thorough with your content, then PYQ is not an main
Right.
problem.
Hmm.
So you just have to do the PYT. I not PYQ, just PYT. Focus on PYT
Hmm.
rather than going for a Q bank for modules like flagship modules. That you shouldn't do this. You can do in your professional examination, but otherwise it's not necessary. I think so. Just do two cycle of PYQ rather PYT.
Hmm.
And if you have done two cycle of PYT for last 5 years, then you can go for even further last 10 years. So it will be sufficient, more than sufficient. You don't need for INICET. I haven't given NEET PG, so I don't know about the NEET PG. For INICET, it's more than enough. Just keep revising. Just boil down your content to a single page and just keep revising it every day. I also use that forgetting curve. So what I'll do कि जिस दिन भी मेरा मतलब जो टॉपिक रहता था वो मैं गूगल कैलेंडर पे लिख लेता था.
Hmm.
मतलब इस दिन मैंने ये टॉपिक किया, वो गूगल कैलेंडर पे लिख लिया. उसके बाद पिछले दिन का, फिर लास्ट 6th डे का, और फिर लास्ट 13th डे का, ऐसे करके मेरे पास 4 टॉपिक हो जाते थे. तो मैं वो रिवाइज करता था सुबह उठ के, पहले वही करने.
Mhm.
उसके बाद यू कैन गो विद योर मेन टारगेट फॉर द डे, and that's it. Don't make it so complicated. It's just like this only.
So perfect. I think ये बहुत ही precious and special बात है about Yudhanshu. I cannot see that any stress or panicky, even though when he was talking about his preparation, and that is most important. Whenever you are performing without panicky, without that fear, I think
Without fear.
efficiency is always more, right?
You
So,
can see the tomorrow, yesterday match also. It's India was panicking.
so that is also a good example for
Good
that.
example.
Yeah.
Mm.
So Yudhanshu, because you are looking so much cool, and can I know the reason why you are not so panicky? Did you completed enough number of revisions? That's why you were so confident about.
Actually, ma'am, it doesn't depends on how much, मतलब how many cycle of revision. It just depends on कि you are with your screen and it's you. You have your content in your mind and you don't know. This 5 years you have studied. It's the same thing you are being asked.
Uh-huh.
So just I have given exam 1 year before in November. I have given it just like an exam. I have some health issues and conjunctivitis is going on. I just gave the exam. I got some rank and I got selected in AIMS Jodhpur and I got pediatrics. And after 3 years of doing pediatrics, I was just dropped out. मतलब not dropped out. I just left out from there. And then I was not able to give the May and ICT because I haven't prepared for it. So next year I gave the exam. So I was knowing कि it doesn't. It's just an exam. It's not your life. So take it as easy as it is. So that's
So
it.
would you like to recommend that how many revisions one should do before the exam?
Uh, it depends on someone as it's not I would like to answer it is very in a conventional way, but it's 2 or 3, it's more than enough. But very important is last 10-day revision is very much important. Even if you are given a one revision, your
Mhm.
last 10-day revision is very important. Last 10 or 20 days, because everyone memory is different. So last 10 or 20-day revision is very important. I can't stress upon.
So what would you like to revise in these 10 to 12 or 15 days that you are saying that is very important? What all to revise during this?
Everything. Just make sure whenever you're revising, just cut down your notes. Just cutting down the content. That make a plan. You have to revise it this much. This next revision in 1/5 of the time.
Mm-hmm.
Okay, so you have to cut down the content whenever you are doing the first revision. For second revision, you have to prepare from now onwards, because अगली बार मेरे को यही टॉपिक इतने टाइम में नहीं करना है. अब मेरे को 1/5 ऑफ द टाइम जो भी है उसमें करना है. तो उससे आपका सारा रिवीजन हो जाएगा. मतलब ऐसा कुछ छूटेगा भी नहीं, और you will not have FOMO.
हाँ, तो वही
ऐसा.
मैं हमेशा बोलती हूँ कि यू शुड ऑलवेज डू द पिरामिड रिविजन, ताकि
हाँ.
लेसर एंड लेसर नंबर ऑफ आवर्स यू विल रिक्वायर फॉर द रिविजन्स, क्योंकि एवरी
रिवीजन.
टाइम सेम नंबर ऑफ आवर्स नहीं मिलेंगे रिविजन के लिए.
हम्म.
कौन से सब्जेक्ट्स पे हमें ज्यादा फोकस करना चाहिए व्हेन वी आर बेसिकली इंक्लाइंड टुवर्ड्स द इनसेट एग्जामिनेशन?
For INICT, it's a first or second year examination. Sorry, subjects. Because you can't, if you know, then you can't mark them wrong. मतलब you can't mark them wrong. And especially short subjects. It's very much high yielding, like forensic medicine, psychiatry, it's orthopedics. It's very much high yielding and it's very conceptual. No one is asking you the fact. in INICET, it's very conceptual, and focus more on anatomy, physiology, biochemistry, and path pharma and microbiology will not only give you the good amount of question, but it also helps you in medicine also, medicine part also. You don't need to read medicine for INICTs. You just need to do some emergency medicine and ALS BLS protocol, just it. And don't stress much upon the medicine. इतना medicine कैसे करेंगे? It's not required at all. Just do
Acha,
that.
nowadays more and more like clinical scenarios are asked, right? Even in INICET, even in NEET, like INICET people used to ask the clinical scenarios beforehand, but now even people are going towards clinical scenarios. So how much you think that now a turn towards the clinical subjects is required more? Because if you are not in a habit of solving the clinical questions, then will you have face some problem in solving them in the main examination?
I think if your first and second year is strong, you don't need to matlab, just do your first and second year subjects very nicely, and you don't find any problem in the clinical, because in you'll see most of the that clinical STEM question, they are from first and second year only. It's very much solvable. Not is no one going to ask you the guidelines. I'm not talking about surgical subjects, but in for peds and for medicine and from the ops gynae medical part, it's very much solvable from first and second year. You
Yeah,
just
but
read
for
first and second
surgical,
year.
yes, they can ask you the
They
guidelines.
can ask. They can ask you the guideline. For medicine. They don't ask.
The path
I don't
and
think so.
pharma
If your
combined.
path pharma is strong, microbiology is strong, it's way too easy for you for INICT. I'm saying that.
Perfect. So, any YouTube videos that you watched, Yudhanshu? We are having series of YouTube videos.
Ashwani sir, YouTube videos I watch. Only one short revision. I have histology I've done from there, and yours videos from 3 3 minute conjunctivitis, because I have a huge problem in ophthalmology. I can't stress upon it. बस मैं इतना था कि सब जितना सब ophthalmology कर रहे हैं मुझे बस उतना ही करना है, एक्स्ट्रा नहीं करना है, जितना सब करके जा रहे हैं बस उतना करके जाओ,
तो कैसे पता कि कितना कर रहे हैं?
जितना आपकी वीडियोस में है उतना तो
Okay.
बस
Okay.
इतना.
All right. Yudhanshu, any other important message that you would like to give to your juniors that you have learned from your journey?
First of all, it's just an exam. Don't take it in a binary manner. Either it's life or death situation. It's not like that. Just you have to give, not in a panic mode. First of all, you have to understand this. After that, there is many type of student, ma'am. If you are in third and fourth year, and I would advise you to make your own notes. However matlab, difficult you find, just make your own notes. You have enough time. I have made my own notes in last 6 months, all on last 6 months. So it's very much doable. Just do your own notes. Don't just blindly follow the Telegram PDF. That it won't work for everyone. Not for anyone. I would like to say.
Like notes in your own handwriting is the best treasure. Nothing can replace it. Nothing.
And you have to just cut down the content. That is the most important. And even uske baad bhi you have to revise in last 15 days and make your 20th notebook. If you are in such a kind of person, I do make my 20th notebook from GTs. I know this opioids. Just say for example of opioids, I always used to get 1 or 2 questions wrong from the opioids. So I made it in a 20th notebook, and that it goes there, and you just revise and revise daily. Actually, revise your 20th notebook daily for 10 to 15 minutes. Just not in a very efficient manner. Just scroll down under the pages, and just you will be okay. And last 2 days you have to do the 20th notebook. That it and takes. Don't be so stressful on your GTs. GTs. Actually, I haven't got under 500 ever in GT. So GT is not your matlab, actual
Testing tool nahi hai. Take it as a learning tool.
learning tool. Make sure where you are going wrong. It's whether it's a fact based question you are getting wrong, or it's a recall based question you are getting wrong, or you have no idea of the question. If you have no idea of the question, you can't do anything. You have to just read more about the subject, and that is not possible in the last few days. So if your recall based question is getting wrong, you have to just do the active recall, repetitive revisions of the subject. And if your concept is weak, just you have to follow that topic very carefully.
So
So
how
that's it.
many GTs you used to give, like how frequently?
15 to 20 days, one GT. I have given only 5 to 6 GTs in last 2 months.
Okay. But do you think that you could have given more and
No. I'm just fine
he
with
is
it.
amply satisfied, like hats off to his confidence, Yudhanshu. Because the students I always keep on talking, they always say, no, ma'am, we could have started earlier, we could have given more. I think that would have been better. But you
That's a past. I mean, we can't say anything. Nah. That's a past thing.
right.
Even I got some question wrong from my notes. That's Hawkins rules. I don't know
Yeah.
where it is. And some of the questions were there in my notes and I get wrong. But I don't bother. I don't. First of the thing I do after coming from the examination hall, I just uninstall my Instagram and didn't watch any recall from
Recall.
INICET. Just let it be. You have given your best on the day of examination. Just let it be. Whatever you have done, make sure you have done it with your 200%, so that you won't have any regret, even if your rank don't come. So, but you have to give it 110%. That's a sure.
Right. So very contented and very, I think, thoughtful message, Yudhanshu. We are very, very proud of you and
Mm,
heartiest congratulations from whole of the team DBMCI. And I wish you the same peaceful mind and the same kind of confidence and best results in your future endeavors also.
Thank you, ma'am.
Thank you. All the best.
Thank you.